Erik H. Erikson, 1902–90 For the psychosocial theory of development. Erik Erikson was born in Germany during a period of intense social and economic change. As a young adult he was heavily influenced by the work of Sigmund Freud and studied psychoanalytic theory alongside Sigmund's daughter, Anna, in Vienna, Austria. The events of the Second World War forced Erikson and his wife to relocate to America, where he wrote his seminal text Childhood and Society, published in 1950, Second ed., published 1963. This book contained his detailed observations on the psychological changes we experience in the period from infancy to late adulthood, changes he described as the 8 ages of man. Erikson, like Freud, saw child development as following a specific pathway through a series of stages that reflect our ability to achieve a certain task. Table 2.2 demonstrates how similar Freud and Erikson's theories are. Erikson believed that each of us follows the same pathway through these stages. The route is linear and unidirectional. We do not double back on ourselves, miss any of the stages or skip ahead. Erikson's proposed stages of child development map neatly onto Freud's theory of psychoanalytic development and expand on it into adulthood and old age. Each of Erikson's stages is described as a crisis between our biological or psychological needs and the experiences we have with others and our social world. This crisis is fought in a similar way to the way that Freud describes in the role of the ego. We have wants that need fulfilling, but we need to acknowledge the role of our environment and the people around us in setting parameters for our desires. The end of each stage is marked by a state of resolution. The child learns to balance their own needs with those of the people around them. For some children there is a satisfactory resolution of their needs and they come out of a stage with what Erikson described as certain positive personal characteristics. For other children there is an unsatisfactory resolution of a stage and they may display difficulties in moving on to the next stage and problematic personal characteristics. Erikson wrote that each stage has its own unique personal characteristic associated with it, and it is possible that problems reported in adulthood may relate to difficulties experienced at a particular developmental stage in childhood. Erikson's 8-stage theory of development. Erikson, 1950, 1963, Trust versus Mistrust, Infancy to 12 months. In the very earliest stage of life, Erikson proposed that we must learn to trust both ourselves and the people around us. We are born with basic needs, such as food and warmth, and need to have these satisfied. If we receive regular care and attention, we learn to trust that others will care for us and will fulfill our need for food or blankets. Erikson did not write that any particular style of parenting, whether it was child-centered or not, was any better for the child, just that there needed to be consistency and predictability to the care. Without predictability, Erikson argues, the child cannot learn to trust that the parent will be there when needed and thus develop a sense of contentment and safety. The baby must also learn to trust himself. During breastfeeding, the baby has to learn that sucking too hard or too softly will affect the rate at which milk is released. When the baby grows teeth, he has to learn to feed without hurting the mother. Babies who have learned to trust themselves and their parents to provide adequate care will often be calm and comfortable in the presence of others and show low levels of upset when the parent leaves the room. In contrast, babies who have not found predictability in their parents' care and have not built up a level of trust are more likely to show distressed behavior and to become very upset when the mother leaves the room. This is not to say, however, that the child should not learn some mistrust. Erikson argued that it is important that the baby learns that others, and possibly himself, are not always trustworthy. Without knowing mistrust, our baby cannot regulate his feelings of trust and will become vulnerable to others and not wary of the danger society can hide. The optimum outcome, then, for this stage of development is to experience high levels of trust, tempered by awareness of mistrust. A child who succeeds in achieving this state will then, according to Erikson, develop a core personal characteristic that he labeled hope, hope that the world is generally a good and safe place to be and that all obstacles can be overcome. With a strong feeling of hope, the infant is now ready to progress into the next stage of development, the crisis between autonomy and shame. Autonomy versus shame, 12 months to 3 years. During this stage of development the infant learns to control their actions. Freud described this stage as the anal stage when the child experiences pleasure at defecation. During this stage the child learns to control when they need to use the toilet and progresses from using nappies to a potty and then a full toilet. Erikson agreed with Freud that the child's development is dominated by toilet training at this age but developed the notion of learning control further. It is typical for children at this age to use the word no more than the word yes, for instance. Erikson argues that the child is developing the notion of control over objects and events in their world, and by saying no, the child is developing a sense of autonomy. Autonomy can be seen in other behaviors of a child. The child may grab a toy from a sibling and not give it back under pressure from their brother or their parent. They may demand to be held by a parent or to be let down, seemingly at random. As the child's expression of need for control increases, however, so the parent starts to set parameters of what they consider acceptable behavior. The development of gender identity, discussed in Chapter 11, is a good example of the autonomy versus shame conflict. Parents start to use phrases such as, "Be a good boy for mommy" or "Be a nice girl for granny now," to encourage the display of socially acceptable behavior. Through this process, Erikson suggests that the child learns to feel shame and doubt about some of the ways in which they want to act, and develop sensitivity to the needs of behaving in accordance with the rules of society or their social norms. Again, the child is engaged in a crisis. This time the crisis is to develop independence and autonomy from their parents and to engage in behaviors they enjoy whilst at the same time doing so within a pattern of social norms and avoiding the feelings of shame. Resolving this crisis successfully will develop the core personal characteristic of will. Erikson purported that the development of will at this stage will result in an adult who in a social context is able to restrain him or herself from making poor choices, but who also is independently able to make decisions that satisfy him or herself. Initiative versus guilt, 3 to 6 years, children of early school age start to introduce an element of competitiveness in their activities. They want to know who is the tallest, who can run the fastest, and who is their best friend. Children at this stage often talk in hierarchies, such as, "I'm the tallest, Sally is shorter than me and John is the shortest," and make games of building the highest tower from blocks and bricks. This stage demonstrates the child's need for initiative, Erikson writes, in that their play becomes goal-oriented and more spirited. Their play can swiftly get out of hand, however, and anyone who has ever looked after a 4 or 5-year-old will know that this can happen. For instance, what starts as a simple game of jumping off a step to the ground can soon escalate to the child wanting to jump off a higher step, until they start to put themselves in danger of falling and hurting themselves. This desire to go higher and higher drives the child to accomplish more and more, but at some point the adult or carer will aim to put a stop to it, often mindful of the safety of the child. Curbing the activity, for whatever reason, then provides the child with their third crisis, Erikson argues, that of guilt. By controlling the degree to which the child can show initiative, the parent is introducing more parameters to the child's behavior. Telling the child, "Mummy wants you to stop that or you will hurt yourself," means that the child has to weigh up their desire to continue jumping from a high step with the guilt of upsetting their mother and even hurting themselves. Erikson believed that limiting activity at this stage of life really has a negative effect on the child, and he felt that After the age of 6 years, the child will have lost all their natural drive and energy and become a more staid, less inventive person. Later, Erikson wrote that this stage might in fact not be all bad. With the right balance of parenting and instruction, Erikson conceded that the energies of initiative could be focused into activities that are more appropriate and that children of this age could be encouraged to find artistic or sporting outlets that allowed them to develop the personal characteristic of purpose. Industry versus inferiority, 6 years to puberty. So far, our child has gained to a greater or lesser degree the personal characteristics of hope, will and purpose. Our child has developed a sense of trust, is gaining in autonomy and is learning to display initiative within prescribed boundaries. The next stage of development Freud called the latent stage, and he described it as a period of time when little of any consequence happened, but the child consolidated developments in the previous years in readiness for the next stage, preparing for adulthood. Erikson, however, saw this stage quite differently. Erikson, 1968. He saw the prepubertal years as being of increasing industry. In many cultures, these years are ones of learning, whether this occurs within the family unit or within a structured schooling system. The child is taught necessary skills in preparation for independent adult living. Erikson's theory has been influential in determining the types of teaching method and assessment that are most appropriate for children at school. If you have a look at the lifespan and case study boxes in Chapter 14, you will see a full discussion of how Erikson's theories can be applied effectively in the classroom. The crisis at this stage comes from the interactions with the tutor of those skills. How many of us remember the shame of being criticized for our lack of achievement in a task at school or the pleasure of receiving a commendation? Teachers use verbal praise, sticky-colored stars and league tables to reward their pupils and to encourage them in their work, but the downside of schooling can be felt when you do not receive that praise and are ridiculed for your poor performance in sport or art, writing or mathematics. These feelings of inferiority last a long time. We can probably all recall failing at a task or feeling embarrassed and still perhaps now do not follow pursuits that we were discouraged from at such an early age. However, with the right encouragement, Erikson argues that we can all succeed at our talents, and by achieving the right balance between our industry and our feelings of inferiority, we develop a sense of competence, our fourth personal characteristic. Identity versus role confusion. Adolescence. Erikson described this stage as a period of intense energy and drive. In Chapter 13 on adolescence we discuss in full the physical and psychological experience of adolescence. Freud described this period as being one of striving for sexual identity, but Erikson went further than that in his theory. Erikson saw the focus of energy in adolescence as being directed at all aspects of life. He saw teenagers becoming upset and confused at all the new demands on them. Teenagers are keen to establish a more permanent sense of identity that is more complex than ever before, at a time when even their very physical shape is changing on what can seem like a weekly basis. Teenagers, Erikson argued, have to deal with creating an identity based on a new physical self, a new sexual self, and a self that is concerned with other, more worldly worries such as religious belief and political persuasion. The teenager changes at such a rate that the only way they can cope with this sudden loss of the old self is to try and identify with others. This drive towards identification takes the teenager to different styles of music, clothes, and activities in their need to feel like they belong somewhere. For many, the pursuit of identity continues through adulthood, but nowhere is it as painful or acute as in the teenage years. As more social, educational, and other options open up to the teenager, so some may feel ill-equipped to deal with this wide choice and, rather than embrace the opportunities, they withdraw and settle into a state of impasse. This crisis of role confusion means that the young person may not be able to assimilate these choices into their identity and instead may feel as if they have fallen off the track or that life is passing them by. Many teenagers take time out from their studies and spend a period of time traveling, trying different jobs or even in a complete state of inertia until they are ready to cope with the adult world ahead of them. As the young person works towards developing their sense of identity and reducing the amount of role confusion she feels, the teenager is building on her ability to achieve long-term goals and developing the ability to make decisions with far-reaching consequences. Erickson, 1974. Without this newfound skill, she will not develop the personal characteristic of fidelity, the ability to pursue a goal to its conclusion, and will find it difficult to make long-term commitments in adulthood. Intimacy versus isolation, young adulthood, where the teenager takes the self-centered approach and strives for a sense of identity based on who they are, what they like and what they believe in. The young adult changes the focus of that drive for identity by searching for intimacy with another. Erickson believed that the teenager is too caught up in finding out about herself to engage in true intimacy with another person. Only in adulthood and the sense of self is robust and your identity firmly held can you start to develop a relationship that encourages intimacy, whilst also allowing for both your and the other person's strengths and weaknesses. Erickson believed that the adult who has a poorly defined identity and has not yet been able to settle their role confusion is unlikely to form a satisfactory intimate relationship. Erickson keenly advocated the delay of marriage until both partners had developed full identities, for without them he saw that the marriages often failed as the man and woman grew emotionally in different directions. Erickson's proposition that you cannot be comfortable with another person until you are comfortable with yourself seems to have become the foundation stone of many marriage and relationship counselors, and probably for good reason. True intimacy in adulthood means accepting each other's strengths and faults and sharing many aspects of your lives. If you are uncomfortable with yourself, you are unlikely to be able really to accept your partner's perceived failings. The crisis facing young adults at this time is that of isolation, of being alone and without experiencing an intimate relationship with another. It is perhaps this fear of being alone that drives many young people into relationships that they are not ready for or able to succeed with. However, with time many adults do maintain successful, intimate relationships that are emotionally and sexually rewarding, and they experience the personal characteristic of love. Generativity versus stagnation, middle adulthood. Erickson described the purpose of middle adulthood as to be focused on care and nurturing, particularly of children. He proposed that success at this stage involved the giving of yourself and your priorities to the raising of children. It is not simply enough, he argued, to have children in order to be generative, but the children you have must be nurtured and you must sacrifice some of your own needs in order to satisfy theirs. Without giving to others, Erickson believed that an adult becomes stagnant and self-absorbed. Although Erickson's theory was child-focused at this stage, he did write that childless couples and other adults without children did not necessarily have to become stagnant. Generativity could come through working with others or caring for others and through roles such as teacher, nurse or priest, but the essential element for Erickson is that these roles require you to change the focus of your efforts away from yourself to the care of others. Without the experience of nurturing and encouraging others, you are left unable to develop fully your potential personal characteristic of care. Ego integrity versus despair. Older adulthood. Once the children have left home and are happily settled on their own life path, Erickson wrote that the older adult begins a journey of reflection on their past and a reconciliation of the past on the present and future. As we get older, we begin to make comparisons between what is now and what was before. It is common to hear members of the older generation passing comment on how things aren't like they used to be and life's changed. Erickson believed that adults who can look back on their lives with happiness and contentment are more likely to see the future more positively and to feel satisfied. If the older adult feels that they have achieved what they wanted to and have been able to satisfy their needs, they are more likely to have ego integrity and to accept that their life has panned out the way it was intended. Adults who are not able to do this are more likely to experience despair and disappointment and to fear getting older. Such adults may become aggressive and dispassionate. They may complain about all the changes and about the failings of people around them. This is likely to reflect the disappointment they feel in themselves for not having had what they perceive as a satisfactory and fulfilling life. The internal struggle of coming to terms with what has been and that perhaps there is little time left for them to make amends is often forgotten in our perception of the older adult. We are quick to note physical and possibly mental deterioration, but we rarely make the effort to understand the role of reflection on the past and its integration into the present. With successful reflection and the development of strong ego integrity, the older adult is rewarded with the personal characteristic of wisdom, the personal reflection on the meaning and value of life, but it can be difficult to achieve if all you feel is despair. Critique. Erikson's theory depends highly on the resolution of your personal sense of identity as the main thrust of human development. Compared to many other theorists, Erikson's theory is unique in describing development beyond the years of childhood and right through into older adulthood. Its strengths lie in the consideration of the full lifespan in personal development and that it does not assume we are complete or unchangeable after the adolescent years. Erikson's theory allows us scope to evolve complexity in our identity as we age and to keep assimilating new experiences. The weaknesses of Erikson's theory stem from his stage theory approach to identity formation. In using Freud's psychoanalytic theory as a foundation for his own theory, he is very clear which personality characteristics we attain at different ages. However, consider the individual differences in development and thus the implications of this approach in understanding your own personal development. Is it possible to be so strictly adherent to the stage theory approach when we are talking about personality development?